All right, today we're talking about something that is quite literally a massive pain in the butt. I'm talking about piriformis syndrome. We're going to dive into some brand new research that pits two very different treatments against each other to see which one really works best. So let's get right into it. Okay, first up, a real pain in the, we've got to start with the mystery itself. What exactly is this frustrating condition, and why is it so notoriously tough to deal with? So let me ask you this. Have you ever had that deep, nagging pain in your buttock that just will not go away? If you're nodding along right now, trust me, you are not alone. This isn't just some muscle cramp. For so many people, it's this chronic thing that makes sitting, walking, pretty much anything just miserable. Well, that culprit has a name, piriformis syndrome. And here's the deal. Deep inside your glutes, you've got this muscle called the piriformis. When it gets angry and inflamed, it can start to press or irritate the sciatic nerve, which runs right past it. And boom, you've got that classic sciatica pain. It actually accounts for about 6 to 8% of all sciatica cases, which is pretty significant. And here it is. Take a look. This is an ultrasound image showing that exact muscle, the piriformis. It's what those little arrowheads are pointing to. You can see how it's kind of buried deep under your main glute muscles. It's not a big muscle, but man, when it decides to act up, it can cause a whole world of trouble. So, the big question is, how do you fix it? And that brings us to the real heart of this whole thing. Researchers set up this fascinating head-to-head battle between two completely different ways to treat it. So let's meet our two contenders. Okay, so in one corner we have the ultrasound-guided injection, or USI for short. This is the invasive option, literally a needle going in with medication. And in the other corner, we have extracorporeal shockwave therapy, or ESWT. This one's totally non-invasive. It uses sound waves from outside the body. So yeah, it really is a classic matchup, injection versus sound waves. Let's break down contender number one, the injection. And I love this analogy. Think of it like a super precise water pistol. But instead of water, it's medicine. And instead of just aiming, the doctor uses an ultrasound as a GPS. It's a real-time map to guide that needle to the exact spot in the muscle that's causing all the trouble. No guesswork here. So here's how it actually goes down. First, you're lying face down. The doctor uses the ultrasound wand to find not just the piriformis muscle, but just as importantly, the sciatic nerve, so they can stay clear of it. Then, the needle goes in and delivers a little bit of corticosteroid and local anesthetic right to the target. The whole time, they're watching on the screen, making sure everything is perfectly safe and accurate. And this is what it looks like for real. On the left, you can see the whole setup, the probe, the needle, and on the right, that's the view the doctor gets on the screen. How cool is that? You can literally see the needle, pointed out by the arrows, sitting right inside the muscle. That kind of precision is why this thing works so well and is so safe. All right, on to contender number two, the shockwave, ESWT. If the injection is like a sniper strike, this is more like giving the muscle a deep tissue massage, but from the inside out, using sound waves. It's a totally different philosophy. It's not about putting medicine in, it's about telling your body to heal itself. So how in the world does this work? Well, in a single session, they hit the area with about 3,500 of these sound wave impulses. This does a couple of things. First, it kind of overwhelms the pain receptors, which helps dull the pain signals. But the really cool part is that it promotes the growth of new blood vessels and basically kickstarts the body's own natural healing process. Pretty smart, right? Okay, so we've got our two contenders lined up. One's invasive, one's not. One uses medicine, the other uses your body's own healing powers. So, which one is better? Well, it's time for the scientific showdown. Now, to figure this out, the researchers didn't just, take a poll. They used what's known as a randomized controlled trial, which is pretty much the gold standard for a fair scientific test. It's the best way we have to get a real, unbiased answer. And this flowchart here shows you exactly how they did it. They took 70 patients with piriformis syndrome and randomly, that's the key word, split them into two groups. Group 1 got the shockwave therapy, Group 2 got the injection. Then they followed everyone for 5 weeks, keeping track of how their pain and daily function changed. All right, this is it, the moment of truth. After 5 weeks of collecting all that data, what happened? Which treatment came out on top? Well, the results were pretty surprising. This chart basically tells the whole story. On the left, you see the before and after pain scores for the shockwave group. On the right, same thing for the injection group. And what's the big takeaway? Look at that drop. Both treatments absolutely slashed the pain scores. They both worked, and they both worked incredibly well. So, what was the final verdict? Who won? You're not going to believe it. It was a tie, a total dead heat. After they crunched all the numbers, neither treatment was significantly better than the other. No clear winner. And don't just take my word for it. Here's the conclusion, straight from the researchers themselves. They said ESWT and USI appear to be effective. The levels of efficacy may be similar. So this wasn't some wishy-washy result. It was a crystal clear finding. Both of these are fantastic options. Now, a tie might sound kind of boring, right? Like anticlimactic. But actually, in medicine, a result like this can be incredibly powerful. So let's talk about what this really means for you. The biggest takeaway here is powerful, and it's all about choice. This study proves that there isn't just one right way to get relief. You now have a choice between two effective, scientifically backed treatments. And that, my friends, is a huge win for patients. But what about safety? Are there any side effects? Well, the good news is both treatments are considered very safe. The only thing people really reported was some temporary pain right after the procedure. It was a little more common in the shockwave group, but even then it was totally manageable and went away within a few days. Okay, so let's boil this all down. What are your takeaway points? First, you have options beyond just getting an injection. Second, if you're not a fan of needles, ESWT is a fantastic, proven alternative. Third, your choice can come down to things like cost, what's available near you, or just what you feel more comfortable with. And this last one is super important. Everyone in the study also did home-based stretching. That was a crucial part of the recovery for both groups, so don't forget it. So we're left with this final thought. This research wasn't about finding a single winner. It was about giving you options. It was about empowering you. So that leaves the question for you to think about. Knowing you have a choice, what's most important to you in a treatment? Is it avoiding needles? Is it cost? It's a really good thing to think about before you talk to your doctor. Thanks for tuning in.